What's up, guys? So it's Max here again with Physio Forge, and today we're going to do a quick rundown of IT band issues. It's commonly referred to as IT band friction syndrome. I'm going to get on my my plyo box for a second about that, explain a few things, and then get into a technique I like to use to treat that problem when I see it in patients. So the friction syndrome idea is really a misnomer. It's not a friction problem at all. It is a compression tolerance issue or load sensitivity issue. Typically what you have happen is people will go out too hot, too soon, either into hiking or running, and then they cause a compression overload issue of the fat on the outside of the knee. That's essentially what's hurting. There's a lot of factors that go into it. The terrain you're on, so a narrow single track tends to be a little less forgiving than a wide two track. The mechanics of how you move, how quickly you ramp up your loading, your mileage. But what we're going to discuss specifically is another technique you can use to habituate these structures a little bit quicker. So what you're going to use is a modified couch stretch. You could do it on a couch. I'm going to demonstrate it on a box. This is what it looks like. So getting into our modified couch stretch, I'm not going to get my knee all the way to the back of the box. I'm actually going to have my knee a little bit out this time, so I can bias the tissues on the outside of the knee more so than my hip flexors, okay? So what I'm going to do is, say in this position, the knee's a little bit away from the box. I'm then going to drive my hip forward into extension. And now I'm also going to push my hip out to the side, so I kind of get a side bend going without losing that hip extension I started with. And you'll see the angle of my femur to my torso. And doing so, and moving back and forth a little bit, you should be able to recreate that familiar pain you feel when you're either hiking or running. And that's what you're going for. That's essentially what you want to do. It's like rubbing your hand with a little bit of sandpaper and building a callus, right? We're trying to make the tissue more resilient so it can handle the load you put it under. What I typically dose is 90 seconds, 2 minutes of that technique. Ideally both sides, for sure on the painful side, but I would go for both sides if you're having the issue. It can be great to do before you go out and try and do a little bit of running, a little bit of hiking, and then maybe another time or two throughout the day. A few times throughout the day, working on that technique to recreate a little bit of that knee pain will help you along in a few weeks be much more resilient to the load of running or hiking or whatever you're doing. And that is what resolves IT band issue problems. It's not, again, it's not a friction issue, it is a tolerance to compression issue. So this will help expedite the tolerance to compression along with a pragmatic increase in your mileage and your training program. But give that a try, see what you think about it, and let us know with feedback. I found it very helpful in working with it in the past with patients and also on myself. I've had this before when training more running in my summers and my springs. So give that a try, see what you think, and yeah, I appreciate you watching the video.